Commissioner Baker McCormick. Commissioner Marecki. Commissioner Anderson. Commissioner Colleen.
Presente.
Chair Scott.
Present.
You have a quorum present. B, Chairwoman's remarks.
I'd like to say is Happy New Year's.
Oh.
Good to see all of you here. And we just gonna be moving forward, right? Good, we got a lot of work to do. That president is here today. Lord. We gotta get Terry to talk to him. He don't listen to nobody though. But anyway, next time, please.
C, approval of the December 9th, 2025 meeting minutes. We have a motion by Commissioner Marecki and a support by Commissioner Colleen.
Tonight.
Motion carried.
Item 20.
D, unfinished business. There is none listed. Moving to item 1, under new business, reporting the Warrant Enforcement Bureau report, including status, activities, and accomplishments of the WEB performance by business unit and department, comparing the results from fiscal year 2023-24 to fiscal year 2024-25.
So moved.
We have a motion by Commissioner Anderson and support by Commissioner Marecki.
I got a question or two. Thank you, Madam Chair. I'm just looking for a little clarification on this report. I'm not exactly sure what it's telling me. This is what's going on with the they call them warrant enforcement, the Web Warrant Enforcement Bureau. I noted in the report that house arrest services is being utilized. Apparently that was a firm hired by the Sheriff Department, if I'm reading my report correctly.
Hi, good afternoon, Commissioners. Tia Lorian, Deputy Director of Juvenile and Youth Services. Absolutely. Tia Lorian, yes, Deputy Director of Juvenile and Youth Services.
I'm Captain Muscarella. Yeah, oversee the web unit.
Somebody answer that.
Yeah, Commissioner Colleen, you're referencing regarding house arrest. So house arrest is a contractor with JYS, and they're solely responsible for the tether monitoring of the juveniles. Can you elaborate one more time on your question?
Monitoring tethers.
Yes. So
Okay.
only the so we have pre-adjudicated and post-adjudicated youth that are court ordered to be tethered,
Right.
and house arrest as a contractor is responsible for the tether monitoring of those youth.
Okay. I guess I was expecting a little something different from the title of this report than what I was actually reading. Because, and I understand this, we've been trying to do this for a long time in the county. But the data we got was just how many kids on tether. And it doesn't tell me anything about people violating their tethers. How many of those did we have? How many people did we have to rearrest and put take off tether and put back? So I guess the increase year over year that this shows, is that an indication of kids being kept at home instead of in the system somewhere?
Yes. So the idea was that that the judges and jurors can court order a tether and they can stay in home. So it's in-home supervision to decrease going into placement. So we have seen an increase in that, and I can most definitely give you a more detailed report on tethered youth and their
Yeah,
how many violations, what kind of
well,
violations.
that's what I'd be interested in seeing as I'm trying to do my oversight here. In terms of what's going on out there. Um, so yeah, more data. I was like, okay, this doesn't tell me a whole lot uh, in this report on what the web is doing and how we're monitoring these young people. One other thing I want to ask, how much does a lack of the state being able to provide secure housing for youth, because that's been really bad.
Are you referring to residential placement?
Okay, we'll call it that.
Okay.
Yeah. And it's really gotten bad with the state, and it has been for a while in terms of funding, so that we have that as an option. How much of what I'm looking at here plays into the fact that there is a lack of residential housing out there for young people?
So it can impact. So if there are longer periods of time for youth to wait for a bed, sometimes their probation will change to get tethered and stay at home. So that has been happening. It can happen via court order. So I can definitely show you the information and stats on that.
Now, do judges, when they order the tether, in that order, do they discuss we're going to do this in lieu of or kind of in a holding pattern for when something becomes available in residential?
Yes.
Do they discuss that in their order?
Yes, sir. The court order will indicate in narrative form the purpose of this and why they're doing that.
Yeah, because I'd be interested in that too. How many of the judges are saying, okay, we're going to tether because there's just not enough residential beds for these young people?
And I can get that information for you. Are you interested in the year of 25? Or are you interested in previous years?
Well, it's always great to see trends.
Okay.
Over 3-4 years, what are the trends here so we can see where we're going? Because we will be asked to approve various things at this table to move to full board, and to have more of the history and where we're going with this, I think would make better informed decisions.
Absolutely. I will get that information for you.
All right.
And how
Thank you.
many is on tether?
So I believe I might be a number or two off. I believe 134. I might be off by a number. I can't remember exactly with the email from this morning, but I do get that every day. So I can most definitely share an email with the exact amount on tether today.
Okay.
130, 134.
134. Thank you.
You're welcome.
Commissioner Maraki.
Thank you, Madam Chair. So just going off what Commissioner Clean was talking about, would a child that should be into a secured bed that the state doesn't provide, would they be eligible for a tether?
If a youth is on probation too, they are. Yes, they
But
can.
I mean, if they were going to qualify for a secured bed,
Yes.
they would let them on tether sometimes, because those are pretty serious offenses, right?
Yes, they can sometimes de-escalate them to send them home on a tether pending placement or just their probation entirely.
Okay. And so there are a little bit of statistics, but I guess this is to our sheriff here. The compliance checks that you do, the swapping of the devices if they're damaged or malfunctioned. And I'm assuming damaged means
Tampered with, yeah.
tampered with. Okay, so one of Commissioner Clean's questions was about how many of the kids end up them taking the tether away from them and sending them to more of a restricted.
Okay, well, you can see the year over year of what happened this year compared to what has happened in 2024. So at 94 arrests detainments of a juvenile. And that would be partially because of the tether, or they violated a court order. That's where these numbers are going up. Since I have my deputies doing this now, that they are doing a lot more compliance checks and they are monitoring the youth through house arrest services. They give us a call and say, this youth is not supposed to be in this area. And then I deploy the deputies out there, and they make the decision then if they're going to take them back before the judge or they are going to speak to their parents.
But you're seeing that escalating.
We're seeing it because now we have the deputies free from doing what they were doing before. Before they were just putting tethers on the youth. Now we actually have a unit that can respond to these crimes in progress or these kids that are on tether that are out of their restricted zone.
Okay. So they can monitor all these kids at the same time. It's not like just picking and choosing. We'll look at this one.
So that is house arrest services.
Yeah.
So they will let us know, like, hey, this kid is not, he's out past curfew, or he is in an area he's not supposed to be in. And then the deputies can go there and they can,
Because it alerts.
yes, it alerts them. They monitor it 24/7.
Yes, yep. So house arrest is going to be everything over all the tethers. So they'll do the installments and they will do all the monitoring, and then they'll specify with captain's assistance when it comes to deploying anybody out in the community for assistance. So that's the increased number.
Okay, sounds good. Thank you.
Okay, Commissioner Peterson, Mayberry. please.
Thank you. Thank you for your work. I do have a question. So in addition to the status and the responsibilities and even the collaboration with some of the programs, do we have now with this model for staffing, do we have the right number of staffers we think for the demand that we have? Or are we, I guess my question is, are we benchmarking any national, are we doing any national benchmarking, or are we becoming the national benchmark for a program like this?
As it relates to tether, or as in for the deployment for web?
Yes, so web.
So I can't speak to what other jurisdictions do, and I don't understand how it relates to the national level.
Mhm.
I know what our program is and how we're trying to move forward with it. And we're in collaboration with the courts and the CMO officers, their probation officers. And we're just trying to get these kids some services, and whether it be they have to stay in JDF for the night or there are other youth services that they are being provided. That is our goal,
Mhm.
is to get services to the juveniles.
And I think even talking to end users, they're very appreciative of the process. And so that's why I thought, I like for us to be the leaders in a bunch of spaces. And so if that's the case, then we are creating a benchmark for others to see what we're doing and see that it works. So to our commissioner's point about making sure that we have the data that we are sharing and providing, and if there's some gaps, then as commissioners, we would need to know where those gaps are so that we continue to make sure that the services are adequately provided.
Absolutely.
Thank you.
Yep, we would
Thank
love
you,
to be
Madam
the
Chair.
benchmark for all the others. Absolutely. I'm right there with you.
Thank you. Commissioner Colleen.
Well, thank you for recognizing me again, Madam
Sure.
Chair. I have one follow-up question here. So I'm looking at the report that has the two data sets. So I just want to make sure I'm reading this right. So the top graph shows in 2025, and I know that number needs to be updated because this only went up to like September 30. But looking at this graph, Webb detained 94 juveniles in 2025. Now, if I look at the bottom chart, in fiscal year 2025, we had 1,770 kids on tether. Am I reading that correctly?
Yeah, so the grand total for fiscal year 25, the grand total of tethered youth was 1,770. However, that doesn't mean that they're all on that period at the same time. So they come and go on that tether.
Yeah.
So I think.
Yeah, we have this conversation all the time about how many people are in the jail, right?
Yes.
The daily changes, and you can't say, well, the average person stays there 4.5 weeks. There's no such thing as that. It varies widely. So out of those 1,770 kids, 94 were arrested for violations.
We're detained.
Is that
It could be for multiple different reasons, for a tether violation or something other occurring that they had done, but some kind of violation of a court order.
so? They got to go appear before
They do.
juvenile court, and the judge makes some sort of decision. Either we're going to have to put you in juvie, or, okay, we're going to leave you on tether given the circumstances. So those are the kind of numbers I'm curious about. Like, out of those 94, how many were returned to custody? How many were allowed to stay on tether? It just is a fuller picture of what's going on in there. So thank you for recognizing me again, Madam Chair.
Certainly.
Thank you.
So Commissioner Clean, I will get the data for the 94. How many of the 94 and 25 returned to JDF, stayed detained and or stayed on a tether within the community?
I think that'll show us a lot if, you know, what the judges are looking at. And, okay, we'll just leave it at that. Thank
All
you.
right, you're welcome. Commissioner McCormick.
Thank you, Madam Chair. You mentioned earlier about secured beds and some of the youth not being placed or placed on tether because there are no beds. Is that true in the case of someone with mental health related issues? Do we still send them home with those
So,
types?
yep, so the judge will ultimately decide if they would like to keep the child on that probation level. And so very little have we seen where the child has stayed at JDF for a long period of time due to a bed. So it's not that the bed is not available, it's the duration of the waiting time. So level of stay at JDF to get into secure placement. We've seen very few where they went home due to the length of stay. As it relates to mental health, they do and they have taken consideration of the youth's mental health and the status of them while at JDF for placement.
So we are still tethering those individual with mental health issues if need be, if they don't have a bed.
Yeah,
Is that
so,
what you're saying?
yeah, so they have that, and they also have mental health court where they do focus on their mental health needs instead of entering the system via tether. So they do focus solely on their mental health status instead of getting them into the system.
Okay, so I'd like to know that number as well.
Absolutely.
Okay. Thank you.
Anyone else? All right,
Thank you.
thank you.
Thank you.
We had a motion and support on this already. Okay,
Correct. We just need a vote.
yes. All in favor? Okay,
Motion carried.
all right, thank you. Next item, please.
Item 2, forwarding report on the medical insurance reimbursements redirected to Medicaid for inpatient hospital services for patients registered as Wayne County jail inmates in fiscal years 2023-24 and 2024-25.
Okay. Is there someone?
Good afternoon, through the chair, Ebony McCann, Health Human Veteran Services Transition Services Division Director. The report before you today is pursuant to Ordinance 2024-664, in which the department is required to submit the number of patients and the charges that have been redirected to Medicaid for fiscal year 2024, so the period of October 1st, 2023 through September 30th, 2024. There were 71 inmates at the Wayne County Jail whose care required escalation to a medical facility. Hospitalization is anything over 24 hours. And for the patients in fiscal year 2024, we redirected charges in the amount of $6,313,851.06. These are charges that Medicaid absorbed completely. There was no charge to the county. Similarly, for fiscal year 2025, so October 1st, 2024 through August 2025, there were 28 patients that required overnight hospitalization, and those charges that were redirected to Medicaid totaled $4,064,342.02. Had these charges not been redirected to Medicaid, this would have been an expense to the county. So we are forever grateful for our county employees that review these services and work collaboratively with our jail healthcare provider to ensure that the services and invoices that are supposed to be redirected to Medicaid are done so in a timely fashion.
All right, thank you. Are there any questions? Commissioner Khalil?
Thank you, Madam Chair. Good afternoon. Thanks for the report.
Good afternoon.
I'm fully aware that the 24-25 data is not a complete year. It's 1 month short of that. But, well, first of all, these numbers used to be a lot bigger that we had to eat on Medicaid before we got serious about getting all of the people that we have in our custody signed up for Medicaid. So I'm glad this number is down. We go back 7, 8, 9, 10 years. There were some really big numbers. What I'm asking about here is, even though the 24-25 data is short a month, any insight as to why the number of people that had to get medical care outside of our facilities dropped by almost half, or a little bit more than half?
I can't speak directly to the medical care that the inmates may have received in the community, but that may speak to efforts in the community of our local health care providers and professionals that are ensuring that indigent individuals or individuals who require health treatment in the community are receiving adequate care. And so when they come into custody, those needs do not elevate and have not escalated to the need of hospitalization. So again, I can't speak to what inmates do while they are not in our care or custody, but based on the number of inmates that were triaged and were deemed medically appropriate by our medical director at the jail, we, luckily only sent out 28 patients in fiscal year 2025. And as you indicated, that is short 1 month.
But is there anything we can attribute that to? Or do we look at what the reason is that, well, you just said they're looked at the medical people. The reasons people are having an emergency where they have to leave. Are we tracking, like, is this diabetic, right? Is it drugs? So that we know in how we handle the people in our custody, what the reasons are that people are leaving the facility. Do we track what do we have like a little chart in here?
Yeah.
10 different things that people got sent to the hospital for?
So through the chair, our medical provider compiles and maintains a list of all patient care records that indicate or suggest what medical needs necessitates a hospital stay. Our jail health team review that document, and we maintain a copy of it. Obviously, with HIPAA, we don't want to violate any inmate private care information, but we can provide a list of those ailments that would necessitate a hospitalization stay, as well as I will have a conversation with our medical director to see if she has identified any trends that would speak to the decrease in individuals that were sent out.
And I'm wondering if we use that data to guide what we do. When you look at it and you go, whoa, here's a category, that half of the people got sent out of the jail for. Is there something different we can do in our facilities to alleviate that? And just like with the last report that we got, more deeper information is better than just a few summary numbers, because these summary numbers represent human beings. And so if we're using this data about people being sent out of our facility, are we using it to sharpen our own how we approach these things in our facility? Are there things that we could do? Is kind of what I'm looking for. But I would like to get Alyssa, I ain't gonna mess with HIPAA, so summary data is fine. But what are kind of like the reasons people were sent out of our facility?
Understood.
Thank you. Thank you, Madam Chair.
Okay, you're welcome. Commissioner Marecki.
Thank you. And you know what I'd be interested in too, if you have the statistics for 2022 to 2023 as well. Because that is a significant drop, which is great.
Through the chair, if I may, the budget ordinance that was submitted December 15th, 2023, that spoke to the number of patients that received services in fiscal 22 is as follows. For October 1st, 2021 through September 30th, 2022, there were 29 patients that were hospitalized. And as a result, there were $2,317,617 that was redirected to Medicaid. And then for fiscal year 2023, October 1st, 2022 through through September 30th, 2023, there were 45 patients. And that number of redirected expenses to Medicaid was $3,323,737. So it's a significant increase for fiscal 24-25 in comparison to 22-23.
Thank you.
Sure, Commissioner Kling.
See, just on that, that provides a longer term view. So hopefully you can submit those numbers and even maybe go back a few years. Because then the question from this chair would be, whoa, how come it almost doubled a couple of years ago that we had more of this? So that gets into the data of what's going on that people are having to leave the facility. So, you know, the longer term data that you have, the better it shows the trends of what's really going on.
If I may, through the chair, the ordinance requests a 2-year comparison. So this document was submitted on or around December 15, 2023.
Well, we'll amend that,
Okay.
you know, because that's one of the things that we learned. I didn't draft that. But, you know, 5-year chunks of data gives you more of the trends of what's going on for us decision maker types. So, yeah. So even though I'm asking for more than the bare minimum here, more than what they're showing or what the ordinance is asking for, but we can amend that ordinance. Thank you,
Oh, you're welcome.
Madam Chair.
Ms. Carr, do you want to say something?
Through the chair, Mary Carr, Deputy Director. Ebony's correct. We only asked for 2 fiscal years data, but moving forward, we can look at asking for maybe 3 or 4 years of fiscal data or 5.
You're not
So-
getting trends till you hit about 5 years.
So these budget language instructions are discussed at our last Ways and Means meetings for the budget season. And we go over them so that the commissioners can decide how they want to change them or add or delete things. So we'll have proposed languages set for those. Thank you.
Is that it? Did you have a follow-up?
Comment, you know,
Okay.
with these budget instructions, and there's only 700 of them or something, that sometimes it's not apparent until we actually see the report. It's a little bit different than sitting there during budget hearings and reading through all of these and, you know, what they all really mean. But then when you actually see the report, you go, well, we could use a little bit more. So thank you, Madam Chair.
Thank you. Thank you, Mary. Commissioner McCormick.
I was just gonna reiterate what the Commissioner Colleen just stated, but also, Mary, are you keeping a note so that when budget season comes around? Okay, great. That's great, because
All right, thank you.
Anyone else? All right. Okay. Thank you so much, Ebony. All right.
We have a motion by Commissioner Baker McCormick and a support by Commissioner Marecki.
All in favor? Yeah. Okay.
Motion carried.
Motion carried. Thank you. Next item, please.
Moving to item 3, requesting commission approval of a 1-year local health department grant agreement with the Michigan Department of Environment, Great Lakes and Energy, Drinking Water and Environmental Health Division to provide funding for environmental public health program services to residents of Wayne County.
Good. Yeah. Here we go.
Good afternoon, Commissioners.
Good afternoon. Thank you.
I'm Dr. Brianna Eccleston, and I am here just for the grant acceptance from Environmental Great Lakes and Energy and Drinking Water. This is a total of $67,580 from October 1st, 2025 through September 30th, 2026. And this covers various programs under our Environmental Health Department, which includes our about $7,855 for our private water program. We have for our pool inspections approximately $53,380. And then for our septic program, we have around $5,100 there, and then $1,245 for neighborhood services, which includes our campgrounds.
Okay. Thank you, Commissioner Marecki.
Chair. So the pool program was reduced by 5,000?
Yeah, 5,255.
So are you going to still have, will you still be able to do it?
Yes,
Okay.
a
'Cause I
lot
was
of
wondering if do the pools send anything into Wayne County, any information?
Yes. So for the pool inspections, which we have actually increased the pools within Wayne County that we do inspect. So that is part of why we get a decrease in the grants, just because our inspection fees for the pools basically kind of filter that out. And so the grant will just end up decreasing due to the amount of fees. So they don't need to cover that as much.
Okay.
So yeah.
Okay. So
Yep.
you say
So we don't have any, yeah, we're able to cover all of our pools for Wayne County.
out once to the pools?
I think most of them we do annually, yes. So depending upon if there is any issues though that will come up, then there will be additional inspections for those
So do the pools
cases.
have to send anything during the summer to Wayne County, the summer pools? I'm talking about more the summer
Mhm.
pools, because you do the inside pools.
We do
as
the
well,
inside
right?
pools and we do the outside pools.
Okay.
Yes. So usually they will, around this time, actually in January and February, all of the pools will send in their licensing fees. And then from there, we will go ahead and schedule out the inspections. Yep.
That was good. Thank
Yep.
you.
Thank you. How many pools do we have?
I will have to get that number for you and send that off. I do not have that off the top of my head right now.
All
Yep.
right. Thank you. Commissioner Peterson.
Thank you. Through the chair, that was a question, not only how many pools, but I also noticed that there's unlicensed pools. So when I saw that, I wasn't sure what that was. Local efforts to educate unlicensed swimming pool owners.
So that's most likely like individual homeowners,
Oh,
most
just
likely yeah,
homeowners.
that you don't have to go out and do those inspections. But this is primarily the ones that we inspect are those that are open to the public are what we prioritize there.
Okay, so
yep.
we're educating them, but there's nothing punitive if they do a personal inspection or not. Or
Right.
are we strongly encouraging them to do that? I'm just curious, like if I have a pool in my backyard, how do I even know that I should be doing some of these things?
Some of those things.
Yeah.
Yeah. So a lot of that information that we do have available too on the website in regards to like keeping up with your pools, in regards to like, the safety
Mhm.
and the health, the health risk that would be for any of those type of things. And then so pretty much up to the actual owner that would
Yes.
probably have to reach out for that type of information. And most likely, if you're having someone that is taking care of your pool, I'm pretty
Mhm.
sure they will also provide that as well. So,
Thank you.
Yep.
And just even us making sure that this information is shared so that they do know, oftentimes we want to say people aren't in compliance, but oftentimes they don't even know what that looks like.
Yeah.
Thank you.
Yeah. No problem.
All right. Commissioner McCormick and then Commissioner Anderson.
Thank you, Madam Chair. And to that point, about pool safety.
Yeah.
And do we have a an announcement or any literature, any media that
we'll talk about that.
or that we can share?
I can go back into my staff. I'm pretty sure there is some, and a lot of this is also trickled down from the state that they'll give us a lot of those, education materials. So we can definitely share that.
That would be great
Yeah.
for our newsletters.
Yeah.
As well, the inspections
Yes.
for the summer, are they held, when are they given, I guess? Is it like in May of each year? If it's once a year, you indicated?
Yes, I
Right
believe
before
they're
they
annually
open,
right
or is it
before,
when
yeah,
they-
right before they open. Most of the time you have to get inspected before you're even open.
Okay.
So we have to do the inspections.
Okay, and what does that look like? I mean, is that the water inspected, or is that
That's
the
beyond just the water,
water,
but
right.
also just making sure
The
you have like
filtration?
phones.
Yeah.
I mean, you have to think about also, we have to go and inspect pools, like if someone has a drowning or things like that. So you have to make sure that those things are in place. So that way, if anything ever happens, there's a phone nearby. There's other little things that we do have to inspect, a part of our protocol for pool inspection.
So it's not just the water quality, it's also everything that goes
Within that environment. Yes.
Okay.
Yeah.
Great. Thank you.
You're welcome.
All right, very good. Commissioner Anderson?
Thank you. Thank you. Along the lines of my colleague across the table, I've just wondered, do we have anything that's put on the county website or is that something that could be done where people could look up?
I'll have to look at the website too, just to make sure everything is updated. But I know that we do have all of our programs up there, and it has a lot of that information about what you need to, in order for you to have a licensed pool, what those standards are. And most of the time that's just in alignment with what the state laws are. And that's just kind of reiterating what we're looking for. So we do have that information on the website majority of the time that we'll make sure is updated. But again, I can definitely make sure that we have any other additional education material we can send out to you guys.
Yeah,
Right,
I was going to say,
Commissioner
share with
Colleen
us so
and
we
then
can share.
Commissioner Marecki.
Thank you.
Yeah.
Thank you, Madam Chair. I'm not sure where it fits in here, but we have also tested beaches, not
Yes.
pools. I believe the lake in the northwest corner of the county, northeast, Belleville Lake.
Yes.
Don't we
Yes.
test Belleville?
We do. Yes. So we actually
I don't like
do not
that.
have funding. Well, we don't have
Kind of, sort of.
we don't have funding ourselves for the beach monitoring.
Does this cover it?
So no, the Eagle grant does not cover beach monitoring. We did actually partner up with Wayne County. There was a professor that I'm forgetting his name at this moment, but he does have his students that actually went out, and they really helped us actually collect that information.
Wayne State.
Yes, through Wayne State. Yep. And so they did give us those numbers. They worked with our EPI team as well to be able to just filter out those numbers. And it was something that we actually monitored this past summer and brought back into place because, again, that's just capacity building on our environmental health side, where we have not had the staff to be able to consistently do that. And within Wayne County, we just do not have as many beaches as some of our neighboring local health departments. So.
Is that going to continue with Wayne State?
That plan is to go ahead and continue that and also build our capacity as well. So that way we can also have staff that will be able to continuously monitor those beaches.
Yeah, because, I think those open waters are a little bit different of a story.
Yeah.
Over the summer, Oakland and Macomb County, was it a little bit of a tiff about where the pollution was coming from in the Clinton River?
Yep.
And of course, that goes into Lake St. Clair, and we're downstream from that. And so those numbers can change, and sometimes rather quickly.
Yes.
Or with the heat and the growth of E. coli, those things can erupt. So how often do those beaches get looked at for testing?
I would have to find out how often they do that, but a lot of the times that is not done until the summer months. So that's something that we do a little more inspection of.
Yeah, well, what I'm kind of saying here is, since it is a little bit different, since
Yeah.
those waters can change, then a test in July is no guarantee that the water is safe in August.
Mhm.
Hi, good afternoon.
Good afternoon, Doctor.
Dr. Chef, Medical Health Officer for HHVS. I just want to add to what Dr. Eccleston reported on. So we restarted beach monitoring last summer after it's been on hold pretty much through the pandemic years. And so we restarted in partnership with Dr. Rahm's lab at Wayne State University. And it's a really collaborative effort. And they basically start once there's three main bodies of water that are that people in Wayne County actually, do swimming activities and do other activities where there's going to be interaction with the water. Because there's other bodies of water where there's not necessarily human interaction. And so Newburgh, Belleville, and Sherwood Pond. And so him and his team go out pretty much once a week throughout that summer months once the beach opens for kind of beach activities until they close.
Once a week.
And then those results are posted on Beach Guard, which is a public facing site. So if there is a action that needs to be taken place, like activities have to be put on hold, which did happen last summer at one of our sites. Public has access to that right away. And then we also work with our teams to post signage at the sites until, oftentimes, like you said, it fluctuates with rain and all of those things throughout the summer. And so 1 week it could be extremely high, like you don't even want to look at that water, let alone get close to it. And then later on, it could be just fine. And I know we want to make sure that residents have access to the activities when they can.
So weekly data.
It's weekly, it's once a week. And then we oftentimes, if there are, concerns with heavy rains and stuff, they may even go out more than once a week.
I'm glad to hear that. Do we share any of this with the city of Detroit? Because they're downriver too. And, the beach at Belle Isle has gotten a lot more popular in the last 4 or 5 years and a lot more usage. So whatever's coming from St. Clair County, from Macomb County, is going to wind up on that beach at Belle Isle. Do we share data with the city health department and look at their results?
Yeah, so we have a good collaborative relationship. So if there is something of concern, we do like to give each other the heads up. We send out notifications whenever there is a closure or any precautions that they will receive as well. And so there is a collaborative effort there. Yeah.
Okay. And then the last one, Madam Chair, thank you.
Sure.
What the heck is non-community water supply program? Non-community water supply program. I was thinking that might be the beaches, right?
No.
Like St. Clair covers a lot of communities, so no specific one. So what is this stuff?
So those are our wells. So usually within residential, those that have actual wells, our inspectors have to go out and inspect the wells.
Okay.
Yep.
Mostly out in Western Wayne, I'm sure.
Yeah.
Along with the whatever's left of septic tanks out there.
Yes.
Okay.
Yep.
All right. Thank you. Thank you, Madam Chair.
No
All
problem.
right, thank you. Commissioner Marecki.
Thank you, Madam Chair. I have a district that has a lot of club pools. So when you go out to inspect the pool situation, is it coordinated with the health department or do you do it for the concession stands?
For their concession, if they're at the pools, yes, they will do all of those.
Oh, they'll do it
Yes.
all. So you don't have to have the health department come in or that is.
No,
part of
that
the
is,
health
that
department.
is, yep.
Okay.
Yep.
Okay. I wasn't sure.
That
what
is the list
department.
that we're,
Okay. So the
inspecting
health
all of that.
department does the whole thing.
Yeah, so depending upon whatever is included at that public pool, those are a part of the inspections.
Okay.
Yes.
So I didn't know if it was two separate entities that did that,
No,
like a
it's-
restaurant check.
Yep.
And then the pool check.
Yeah. So
Thank you.
Commissioner Peterson Mayberry.
Thank you. Through the chair, just one final question on this. And so schools are in compliance according to the state. So do they fall in the same space? Schools that have the
schools
pools?
that have pools, yes. If they're schools, gyms, things like that, all those type of entities that are open up to the public, we do have to follow up and do those.
Okay.
Yeah.
Thank you.
Right, you're welcome. Anyone else? No, all right. Thank you both. Yeah, getting ready for the summer.
Yeah, yeah.
Won't be long. All right.
It's sunny out though. At least it's sunny.
Okay. Well, if there's no one else, then we get motion.
We have a motion by Commissioner Baker McCormick and a support by Commissioner Colleen.
All right, all in favor? All right.
Commissioner Anderson,
Sorry.
motion carried.
Okay. And,
Second something and then just vote against it for the hell.
okay, with that, motion carried. Okay, next item, please.
F, such other matters as may be properly submitted before the committee.
I don't know of any other. Next item.
G, public comments.
Okay, is there anyone online?
There is no one on Zoom indicating that they would like to speak.
There is no one. All right. Is there anyone in the audience that would like to say something? Anyone in the audience? Hearing none? Then we will move for an adjournment.
Support.
Moved and supported. Marecki.